Namaskar, this is Dr. Hema Divakar, Consultant Obstetrician at the Divakar Specialty Hospital. I'm also the CEO of Artist, which expands as Asian Research and Training Institute for Skill Transfer. We are very happy today that Artist has collaborated with the Bengaluru Society of Obstetrics and Gynaecology, thanks to the President, Dr. Chandrika Muralidhar, who has supported the very first of its kind course for skill development of the healthcare providers, mainly the nursing staff, for building their competency to very confidently and with great conviction speak to the women who are pregnant and who have to undergo the test for checking out on their status of diabetes in pregnancy, and if they are found to have high blood sugars, that is hyperglycemia in pregnancy, these nurses, after this short weekend certification training course, will be empowered to counsel them about what can happen to these women when they have a high sugar. And as you all know, 80% of these can be managed with what is called the MNT, or medical nutritional therapy, whereby if the staff cadre of nurses who are empowered to speak with conviction, to communicate better with these patients, keep them motivated to follow a standard pattern of diet and exercise, we are sure that definitely the dream of 80% of those who are diagnosed with diabetes in pregnancy to be on good control with this counseling and motivation alone will become a reality. So in our vision 2022, we need to collaborate with as many organizations as possible and create a massive cadre of healthcare providers who will do this job of counseling, because we know that in India there are 30 million deliveries happening every year, which means that these 30 million women will need the test for diabetes in pregnancy twice in their pregnancy. 5 to 6 million of them will be found to have a high sugar. These will need further counseling for their nutrition and exercise, which means that we need to have at least 1 million healthcare providers in the form of good communicators, the nursing staff and the support staff who will take on this role of being the catalyst, being the between the consultant and the patient themselves, to fulfill our vision of skilling India for a better and a healthier future. So this is for the very first time Artist has taken this initiative in collaboration with the BSOG, or the Bengaluru Society of ONG. This is the very first batch of 20 staff nurses who have come here to take this training, and further on we would be recruiting many more, and we do hope that our dream of creating this band of good healthcare ambassadors will multiply into hundreds and thousands and millions who are needed to nurture a healthy future, because we strongly believe that women's health is nation's wealth.